Apologies for the slight delay due to technical difficulties today. And if your live stream window on your browser is having any sizing issues, please refresh your browser window and those sizing issues should clear themselves up. If you have any more issues, please contact us in the chat. Without further ado, for today's webinar, we have Ali Burrell from the Washington-Baltimore High Intensity Drug Trafficking area presenting Harnessing Data to Implement Real-Time Data-Driven Overdose Response Strategies. Without further delay, here is Ali.
Hello, everyone. My name is Ali Burrell, and I'm the ODMAP Program Manager here at the Washington-Baltimore High Intensity Drug Trafficking area, or the Washington-Baltimore HIDTA. Thank you for attending today's webinar, Harnessing Data to Implement Real-Time Data-Driven Overdose Response Strategies, which looks at a tool developed here at the Washington-Baltimore HIDTA, the Overdose Detection Mapping Application Program, or as we'll refer to it for the rest of the presentation, ODMAP. So I'll start off today by giving you an overview of where we are in the current epidemic, as well as how that led to the development of ODMAP. Then I'll give you a quick overview of ODMAP itself, the different data variables that we collect, how we collect it, and a little bit more about how the different features that ODMAP has. And then I'll round out with a couple examples of how ODMAP is being used in the field across the United States to help drive those decisions and help save lives in those communities. So the severity of the problem. We've also seen recently in the news how we've reached a benchmark that is a number that I think we never thought that we would see here in the United States, 100,000 overdose deaths within a 1-year period. Between April 2020 and April 2021, 100,306 persons died of a drug-related death. That is a 28.5% increase from the previous 12 months, that April 2019 to April 2020 period. This number only represents the number of drug-related deaths. It does not capture the number of persons who overdosed and the number of persons who are currently using drugs. We also know that this is not a new epidemic, that it adapts over time, and we continue to see it adapting in front of us. We've all tried to look for solutions, and we continue to try to find different strategies. However, we do know some things, that public safety data and solutions alone cannot solve the current epidemic. We also know that looking only at retroactive data alone cannot drive life-saving decisions. To help solve, in quotations, this current epidemic, we really need to look at collaboration and look at real-time data, because that's going to help us save lives, and it will also drive both short and long-term decisions that will help our communities. All of the reasons I just stated in the previous slide led to the folks at the Washington-Baltimore HIDTA several years ago to understand more about what they could do to better understand what was going on in real time in their communities in a way that would allow jurisdictions to not be a barrier, and information sharing in real time to help drive those decisions and allow people to dispatch relevant resources in those communities. That led to the development of ODMAP. So what is ODMAP? ODMAP is a free web-based tool that provides near real-time surveillance of suspected overdose events to support public safety and public health efforts in order to mobilize an immediate response to the overdose events. ODMAP is a national program. You can see here on the left-hand side kind of a map of where we currently have agencies across the United States. We currently have at least one agency working with ODMAP in all 50 states, as well as the District of Columbia and Puerto Rico. We have over 3,600 participating agencies. We have over 24,000 users. We have approximately 15 states that have some sort of statewide implementation strategy. This includes states that have brought on legislation that require different agencies, either public safety agencies or EMS, to report all suspected overdose events to ODMAP. And a number that we continue to also see grow as we're seeing the overdose epidemic continue to grow and impact our country is the number of overdose events that are entered. And we recently crossed the 780,000 suspected overdose event benchmark. ODMAP's goals include providing near real-time surveillance. You'll hear me say that a lot because that's really the focus of our program, is that real-time surveillance. We also look to provide participating agencies with data to identify suspected overdose occurrences and spikes, again, in near real time, enabling participating agencies to develop effective strategies for addressing overdose incidents occurring in their jurisdictions, And lastly, enhancing the development of regional strategies designed to prevent the spread of substance use disorders resulting in overdose events. As ODMAP has continued to grow and expand over the last several years, federal partners have shared their support for ODMAP and its implementation across the country. This includes BJA and CDC through their ODMAP statewide expansion and response grant. This provided funding to 8 different states across the United States to increase their ODMAP engagement and utilization across their individual states. We've also received support letters for ODMAP from the Maryland AG's office, the South Carolina AG's office, and the Nevada AG's office. And several states, as I've mentioned earlier, have also implemented legislation requiring agencies to report overdose events to ODMAP. Some specific examples are Maryland, West Virginia, as well as Florida. So now that I've given you a little bit of background on why ODMAP was developed, let me show you a little bit more about ODMAP and how to engage with it and how to use it. ODMAP does have some agency eligibility limitations. So in order to engage with ODMAP, agencies must either be a federal, state, local, or tribal agency that looks at law enforcement or criminal justice personnel, as well as public health personnel. You can also be a licensed first responder, as well as hospitals with emergency departments. However, this does exclude associated research units commonly seen with some universities. And all agencies must sign a participation agreement prior to gaining access, as it outlines the ODMAP policies and procedures. We do require some data points to be entered into ODMAP in order to collect that as a suspected overdose. Each case entry must include date and time, location. We prefer latitude and longitude. However, we can help agencies geocode that location. We put the outcome, so whether it was a fatal or non-fatal overdose, as well as the naloxone administration. Agencies can also add additional information into their ODMAP cases, which includes suspected drug, demographics, as well as if they were transported to a hospital. So ODMAP users can enter data into the system in 3 separate ways: the manual entry form, something called OD form that I'll go over in just a minute, as well as the application programming interface option, or API. So on the manual entry side, ODMAP is mobile friendly, and by entering it manually, you can also toggle on the geolocation feature, which allows agencies to geolocate themselves without having to collect an address if they're doing this in the field. OD form. At the Washington-Baltimore HIDTA, we also have another tool, Case Explorer, which is a deconfliction program that allows agencies to work with both Case Explorer as well as ODMAP. OD form allows agencies that are involved in Case Explorer to push selected information over to ODMAP. While this is a deconfliction service used by law enforcement agencies, no case information is pushed over to ODMAP, and the information is stored in 2 separate locations. That way, no case-sensitive information is ever pushed over to ODMAP. One feature that we're really encouraging agencies to use is an API, or the application programming interface. This allows 2 different systems to talk to each other without a person having to push or do any additional data entry beyond what they are currently using in their protocols. An API allows for that direct automated integration, again, allowing 2 systems to talk to each other. ODMAP utilizes a REST, or a representational state transfer API, which is combined with a JSON payload to transfer data between both systems. This is a combination of modern technology that is developer friendly, and it makes it compatible with nearly all programming languages. And luckily on our team, we do have an internal point of contact that can help agencies that are interested in this develop the language that allows each system to talk to each other. So we do have something in-house that makes it a little bit easier because we have that person available and can provide that technical assistance. And the API does not require future updates, as it is backwards compatible. Therefore, once it's set up, all data can be pushed, and you don't really have to worry about changing any protocols for agencies. So if they're already collecting all this information, we can connect those 2 different systems, and therefore we're not adding any additional manpower that requires agencies to push that information. One question we get frequently at ODMAP is its relation to HIPAA. The information captured by ODMAP is not considered PHI. The location is translated into a geolocated point where an overdose occurred without any other information about a person. The Washington-Baltimore HIDTA and ODMAP do not retain any address information within the platform or on the server. Any address information is then geolocated, and then those addresses are deleted. The ODMAP zoom function on the national map is also restricted and only allows you to see to a certain level. Therefore, you cannot actually pinpoint which location a person has overdosed at. Now I'd like to introduce you to some of the tools available on ODMAP. Today, we'll go over the national map and spike alerts, but also talk a little bit more about how these different features can help drive decisions as people are utilizing the information included in ODMAP. ODMAP has several features, and this includes the national map. This national map is where you'll see the instant of the suspected overdose events mapped onto a national map. And this allows people to look at cross-jurisdictional suspected overdose event information. You're not limited to just your specific jurisdiction. You can also filter data. And so you can get into the nitty-gritty of things and really understand what's going on in your area, as well as perhaps where your drug trends are coming from in different areas. Or if you're just interested in a location because you're seeing a trend, you can dive into that. Heat maps are available, as well as some pre-designed charts that again allow for quick analysis. We also have spike, overdose, and statewide alerts, which we'll get into in a minute. You can also add personal data layers. So if you're collecting individualized data in your community, you can always add that in, or if you get suspected overdose information from another set, you can always overlap that. We also connect you with the Esri web layers feature and our add a layer feature, which has pre-made web layers. One example we like to showcase is the hospitals. Therefore, you can map those hospital layers directly onto ODMAP and compare them to where you're seeing overdoses in your community. I will note that when you're adding in your personal data layers, that information is not stored in ODMAP. So once you log out and you log back in, you'll need to re-upload that every time because we do not collect that information. Also, one feature that is very important is that multiple agencies can provide data for one specific area. We know that state police cover different areas that might have local police involved or at the county level, and every state is different in how their jurisdictions work. And so by providing the option for multiple agencies to submit overdose data, we allow people to see more about what is actually happening on the ground by capturing more suspected events. And we do have a duplicate check in place. So you might see multiple agencies might lead to multiple instances for one specific overdose, leading to duplicate numbers and capturing a higher number of overdoses than what's actually occurring on the ground. However, we do have a duplicate check in place with some parameters that looks to see if a data entry is potentially a duplicate, and therefore hoping to collect an actual number and not looking at an instance where there are duplicates. So I've talked a lot about the national map. This is the national map and a quick overview of its features using some dummy data that we've plugged in. So the diamonds that you see are going to represent your fatal overdoses, and the circles are going to represent your non-fatal overdoses. Then each of those different non-fatals are then stratified by color based on the naloxone administration. So for example, your red diamonds are going to be fatal no naloxones. Those will most likely be your dead on arrival calls. However, it can vary. And as you can see here, when you log in, you will get the option to apply different filters. So if you want to look at your state or another surrounding state, you can select by the county, or you can filter by specific date and time in order to understand perhaps what's going on in a quarter, what's going on in a month. It's up to you. You can look back historically, whatever it might be. So here we're looking at May 1st, 2017 through November 1st, 2021. And then on the left-hand side of the national map, you'll see in the bottom corner that you get the summary statistics, so the total number of suspected overdose events, the suspected number of fatal, as well as the naloxone administrations that were associated with those specific cases. Then if we jump to the very far right-hand toolbar, that is where you'll get the different options, such as adding a layer. You can change the look of it, etc. All of those features are there. And then if we go to the opposite side back again to the top left, you'll see two little buttons that look like charts and a spreadsheet. Those are going to be where your pre-made chart options will allow you to click on those buttons and where you can toggle those different options on. Some additional features related to the national map. So as we mentioned, cross-jurisdictional data sharing is a key element for ODMAP users. And so Using the national map allows ODMAP agencies to see across jurisdictional across the United States because you can see those data points from all users. However, there are policies about sharing the data available that's on the map, and this is included in the participation agreement because as ODMAP, we are data stewards. We do not own the data. We are not allowed to share the raw data, anything like that. And so all of that is explained in the participation agreement about how that is related to all the individual agencies. It can add in data layers, even using map layout, as I mentioned. And then again, there are filters. Here are some examples, but these are not limited to date, outcome, location, and agency. Here you can see an example of those pre-filled charts that we were talking about for some quick analysis. The available options are overdose by type. This is going to be the first one you'll see. This is going to be broken down by fatal, non-fatal, and then stratified by the type of naloxone dose. We also look at days of the week, hour of the day, suspected overdoses per day, suspected overdoses per month, and then as well as a county state line chart, where if you're looking at multiple areas of interest, you can go in and drill down and understand a little bit more about their relational. So if one area has a spike one day, is it happening in every area that you've identified, or are you seeing kind of, the next day or the day after you start to see a spike as well? Which brings us into our next topic. So another feature available through ODMAP is spike alerts. Spike alerts allow communities to be alerted when there is a higher number than average of overdoses within a rolling 24-hour period. ODMAP worked with the Johns Hopkins Applied Physics Lab to develop a recommended threshold that looks to see within a rolling 24-hour period what a, in quotes, average number of overdoses might be. And then if it's above a standard deviation +2, then it would be considered a spike. When agencies sign up through ODMAP, they can go in and create spike alerts for any area or any county level that they're interested in across the United States. They have the option to utilize the recommended threshold that Washington, Baltimore, HIDTA, and ODMAP have developed, or they can create their own. They can create multiple spikes. So if they're looking to do a preventative program, they can set one up for 3 overdoses, 4, 5, whatever they would like to do, and they'll be notified every time that that spike occurs based on their threshold that they've set up. We encourage folks to utilize the recommended threshold because it does change over time due to machine learning, and as better data is coming in, the algorithm learns the different trends and adapts over time. So while you might start with an overdose recommended threshold of 3, as more data becomes available and continues to come in, and that will change over time. However, you do have the option to set your own thresholds. How a spike works is that over a rolling 24-hour period, say we'll use in Henrico, Virginia here, their threshold is 3 overdose incidents within 24 hours. Once they hit a 4th one within that 24-hour period, the system understands that there is a spike, and therefore it alerts all of the subscribers that are looking to receive spike alerts for Henrico, Virginia. And then that first email saying Henrico, Virginia is in a spike alert is sent out. Then communities kind of take control of what goes on there, and they can dispatch whatever initiatives that they have, and we continue to notify them as long as they're in the spike. We also understand that spikes last beyond that initial 24-hour period. And so if Henrico continues to see above 3 over a period of time, they'll continue to receive communications from us that that area is still in a spike. And then once it drops down below the recommended threshold here, then you'll get an email saying that the spike has ended. These are key features, and a lot of communities utilize the spike alerts, again, from a preventative perspective, but also to see kind of what's coming down the pipeline. So here in Washington and Baltimore area, we know that our drugs come down the pipeline of 95 from New York, New Jersey, Philadelphia. So by setting up spike alerts for those specific areas along I-95, we can watch as spikes are coming down, and we can understand kind of how long we have until we can potentially start to see a spike. So if I am a public health agency or a law enforcement agency, I'm very interested so I can make sure that all of my resources can be allocated adequately. And also I can alert and notify all of the other agencies that we might be needing to prepare our response team, and just make sure that communities understand that this might be coming down, just to make sure that there's that preparedness factor. So I've gone over kind of where ODMAP has come from, what ODMAP is, and given you an overview of the key features of ODMAP. So we want to make sure that you guys can understand how all of this information that agencies are submitting to ODMAP can be used in the field, because ODMAP doesn't just collect data to collect data. It's really about helping agencies understand how data is being taken in ODMAP and transformed in the field to help save lives. So I'll give you some quick examples of how ODMAP is being used in the field and how they use those to drive additional decisions. One example in the field that's related to spike alerts that we just went over is an example from Arlington County, Virginia. On June 28th, 2021, a spike alert was triggered for Arlington County, Virginia. Arlington County is part of the Northern Virginia region, which has 5 neighboring counties. However, it's important to note here that not all of these counties were on ODMAP. And so while we were able to kind of monitor what was going on the local level with the counties that were providing data, there were some areas that we were not sure about. And because of the way that the structure is and all of the movement across the Northern Virginia regions, just due to our highway infrastructure, as well as being a suburban metro area related to Washington, D.C., you don't always find adjacent neighboring counties having similar drug spikes at the same time. So one thing that the Arlington County officials did was they reached out to their neighboring public safety and public health officials to understand what the scope of the spike was. They found out that 2 other Northern Virginia counties reported higher than normal overdoses in the past weekend. And so Arlington County stakeholders then decided that they wanted to get that message out there, because one of the neighboring counties is actually the largest county in the region and is one that has a lot of traffic and where a lot of folks will go to purchase drugs in the area. So they just wanted to make sure they were getting the message out there. And most importantly, they really wanted to make sure people understood about the resources available, either for them or for a loved one. And so what they drafted was a notification to their community, and they posted on their local coalition Facebook page. Their group is called ARI, the Arlington Addiction Recovery Initiative. And I've posted an example of the post here on the right-hand side. It included information on what they were seeing, so the presence of fentanyl. They didn't necessarily share exactly any stamp or where people might be able to find it, but they did make sure to know that fentanyl was there. Local resources, especially pushing where they could get free naloxone, as well as information on our local safe reporting of an overdose law. This particular Facebook post saw significant traffic compared to what the Facebook posts for RA usually do. Their usual posts receive approximately 25 to 40 views, and within 36 hours, this saw over 4,000 hits. And they've been able to utilize this same style of alert several times since this June initiation of their report. And it's something that on the regional level, they've been working to standardize. That way, in our 5-county region here in Northern Virginia, multiple areas are able to push out a similar message, and most importantly, get those resources out there, as well as that information on the safe reporting of an overdose law. We also have folks that are utilizing the spike alert response team or protocol approach. This is where agencies will create a tailored spike response program to ensure that there is that quick response to an increase in spikes or overdose. This should include public health, law enforcement, EMS, hospitals, and adjacent agencies such as medical examiners, coroners, or hospitals. And this is, again, just to make sure that all of the stakeholders who might be involved in the community and might be seeing overdoses are aware of what the protocol is and are receiving updates in real time to make sure that they can respond quickly. And going back to what we said previously about the spikes, you can set those spikes up for any threshold on ODMAP. So agencies can be alerted based on their agency's prevention or response program. So if your area's threshold is 10 based on ODMAP's recommendation, but you want to be alerted when it's 5, that's really an option. And you're able to kind of incrementally decide what that threshold might be, and then make sure that it's included in your spike alert response teams and protocols information. That way they understand whether this is a preventative information being pushed about a potential spike or a true spike. We also have available on our website a spike response framework that's available for different agencies to utilize if they're interested in making their spike response team or helping to develop a protocol. Additionally, outreach teams is something that are also being done in the field. This is where agencies can use ODMAP to identify cases in their specified jurisdiction. So on ODMAP for different entries, you can go and click, and while no PHI is available for the specific person, that has overdosed, you can receive information on the person who has entered the case. And so once an overdose is identified, different agencies will connect with and learn more about, based on their protocols and their programs on the local level, they're able to learn more information about that person, but it has nothing to do with the data entry other than that officer's contact information. Therefore, once they go meet with the reporting agency, they can then implement their follow-up protocol. And this is where you'll see quick response teams going into place and connecting with people after an overdose to make sure that they know about resources and connect them with treatment if they're interested, just kind of depending on what that protocol is. And specific case information comes from the agency itself. It does not come from ODMAP. So now that I've gone over how all of this kind of comes into place and how really truly providing that real-time information from multiple different partners across the United States allows communities, as well as states, as well as regions, to help understand what's going on in their community in real time. I wanted to share information on how, if you're interested in how you can get started with ODMAP, because we do want to make sure that we continue to grow and spread, because the best way to make those data-driven decisions and help make sure you're making an impact on what's going on now and being able to adapt to the ever-growing and ever-changing overdose epidemic that we're seeing is that real-time data. So if you're interested in getting started with ODMAP, if you're part of an eligible agency, you can request access to ODMAP at odmap.org and complete our agency request form. Once approved, which takes about 3 to 5 business days, we can get you a login and you can begin to use all of its features like national map. You can also have multiple users under your agency and provide them different permissions. And so we'll just kind of depend, and it works on what's best for your agency specifically. If you're part of an ODMAP agency, which if you go to odmap.org, you can go and check out which agencies by state are in your area. You can work with your administrator to be added as a user by using your agency code, which we're happy to provide to that specific administrator. Again, ODMAP is all about making data available and allowing the user to utilize it in a way that will help drive those decisions and really allow folks to understand what will work best for their communities. And so that's why we encourage, if you're an eligible agency, to really consider working with ODMAP and being able to go and understand what's happening across the United States, what's happening in your region, and most importantly, what's happening in your community. Now we have a question and answer session, so I'm happy to take any questions. I thank you guys again for attending and listening to the webinar today. Again, my name is Allie Brill. I'm the ODMAP Program Manager, and we'll take time for questions now.
All right. Thank you, Allie, for that fantastic and informative presentation. Let's go ahead and get right into some questions. First one that I have here from the audience, what are some of the barriers that agencies have expressed related to onboarding with ODMAP?
Hi, Tom. Some of the barriers that we've heard across the board vary depending on perhaps what type of agency it is, or also what resources they are. We've heard everything from we're already doing something within our community and already tracking overdoses to we've heard barriers about, we already have a system in place. This would require additional effort from our officers. It just kind of depends on what we're looking at. When we are working with agencies from the beginning, if there are those barriers, we try to have a conversation with them about how we can meet them where they're at and try to figure out best case solutions, because we really do want to make sure that they are being brought on and understand just how valuable a community member for ODMAP that they are, and just how beneficial it is for their neighboring agencies, et cetera. So we've heard, again, everything from we don't really have enough overdoses to need to enter them into the system. We've also heard questions as far as barriers related to, does this cost money? Which with ODMAP, again, as mentioned earlier, is a free service through the Washington-Baltimore HIDTA. We do not have any costs associated with it. And so that's one that we've heard. Again, we've heard about manpower, we've heard everything about HIPAA. And so we really do try to just understand where agencies are coming from and how we can help answer those barriers, or help drive solutions to prevent those from being barriers long-term to bringing them on board.
Absolutely makes sense. It's a lot of things to keep track of, and with all the different either reporting systems or case management systems, record management systems, there's a lot of considerations. So
that there is, yes.
Next question I have here, and actually ties into what we were just talking about. Believe the answer to this is that this is ODMAP available only in the United States or in other countries as well. And I know in this current iteration, ODMAP, I believe, is US only. Is that correct?
That is correct. We are US only. We do include obviously all US territories. We're constantly working to, expand the footprint as far as we are nationwide. We have had previous conversations with potentially expanding into other areas. And of course, we know that the overdose epidemic is not constrained by US boundaries or US borders. And so we're happy to continue having conversations if there is interest in expanding it. It's just a matter of logistics and privacy information, things of that nature, but it's not off. It's not something we haven't explored previously. It's just something that right now we're really focusing on expanding in the United States.
Next question I have here, how does ODMAP account for high rises and multi-story buildings that have the same latitude and longitude and may have multiple suspected overdose events?
That is a great question and one that we get pretty frequently. So as far as latitude and longitude, if you have let me back it up. Sorry. So as far as areas that might have multiple overdose instances within one specific location, we look at two things. So we do track if they're the same location. If it happens at a different point in time where it would not be considered a duplicate entry, then those are just counted. And then you can, as far as you can zoom in, it will show you as best it can that there are multiple overlapping instances in that location. And that's where being able to click on and see the information as far as date, time, location, et cetera, will allow you to kind of see the difference between those two dates. But the latitude and longitude will still be the same. I know we work with like Chicago, LA, New York City, and then also obviously here in the Washington, DC and Baltimore area, those are big concerns just because of how concentrated densely populated areas can be. So we do allow multiple dots on a specific latitude and longitude without it overriding it, unless it does fall into our duplicate check, which we look at if a location is on the same date within an hour of each other. And then if it's within 87 meters or 285 feet, then we'll potentially trigger a possible duplicate check and allow agencies to make sure that, if you have that being a multi-location site or multi-location incident specifically for one time period, then you can check multiple victim and it will bypass that. So we have some opportunities in place to allow latitude and longitude to not be a concern, specifically, especially in areas where you have that densely populated concerns.
Gotcha. Makes sense. Another question here, who has access to the ODMAP and how are individuals able to use the data in accordance with the participation agreement? I know you touched on this a little bit, but if you could give a little bit more detail into specifically the types of agencies that have access to ODMAP.
Yeah, absolutely. And then I'll go, I can do that. And then I'll add a little bit on too, because there are some caveats that we like to say that are important caveats. So ODMAP is available to any state, federal, local, and tribal public safety and public health agency, emergency, so EMS, emergency departments with hospitals, but not affiliated research units, because we do not own the data, therefore we cannot give it out, and we do not allow research unless there's a research request put into place through us, which we just connect you with the data owners. So law enforcement, police, et cetera, really anyone that's looking towards helping to drive decisions on the public safety and public health side related to reducing overdoses. So one of the caveats that we have here specifically that I can think of is where you have states where behavioral health, which would fall under the public health umbrella here. You have behavioral health agencies that fall under a nonprofit. So for example, before working at HIDTA, I was working in the state of Pennsylvania, where their behavioral health agencies, we had a couple that were considered nonprofits. So by definition, these would not necessarily fall under eligible agencies. However, we do look at nonprofits that are working towards overdose reduction efforts, and we can allow them to find sponsoring is I think the best way to think about it is a sponsoring agency, like a state Department of Health, et cetera, that would meet the qualifications, and they can submit a form to us and then make sure that the sponsoring agency approves, and then they would be allowed on to ODMAP. So we do have some things in place because we know different nonprofits and other agencies are like harm reduction, et cetera, are partnering with those law enforcement, public health agencies, other public safety agencies that are working on specific programs where ODMAP would be very helpful, and even are already using ODMAP for programs that they might be implementing on the ground. As far as being able to use data in accordance with the participation agreement, so one of the big things to remember with ODMAP is that we at the Washington Baltimore HIDTA do not own any of the data. The data is retained, ownership is retained by the submitting agency. So when we look at using data related to the participation agreement, we always say err on the side of caution. It's that need to know kind of situation where if you're looking to share information on ODMAP, it's, they retain the information. So things like print materials, et cetera, you'll by default probably want to go ahead and ask the submitting agency that request. And then if it's not something where you own the data, but maybe you're partnering with them on different projects, we can always have you guys work on setting up an electronic MOU, which allows the users to see the raw data on the back end that every other agency would not be allowed to see. So on ODMAP, on the back end, when we say data ownership, that data ownership, you would see the raw data on the back end. I don't even, as the program manager, I'm actually not able to even go and see any agencies' data on the back end unless I have specific agreements set in place, an MOU, et cetera. Just because of the way that our setup, we're a data steward. So as far as though along the lines of the participation agreement, the one big thing is to remember that it's for need to know public safety, public health agencies. It is not necessarily for press when we're looking at the raw data. If there's any specific questions on how to use the data, I'm always happy to field a request. But my kind of go-to is always err on the side of caution. When we looked at the example from Arlington County, when I was working with them on developing it, they did not use any raw data specifically from ODMAP. That was not something that they own, or that they did not own specifically as the submitting agency. So happy to field any of those requests. Again, we want to make sure that there is that compliance in place and that everyone's putting up the participation agreement.
Awesome, thank you. Kind of in that same vein a little bit, you mentioned your level access, and somebody did ask, is there different level access provisioning for the different users with ODMAP, or once your agency is accepted into access to ODMAP, is it just one type of user accessing the system?
Gotcha. So there are some stratifications. So if anyone is familiar with ODMAP, up until January of this year, there had been what was called level 1 and level 2 users. Those do no longer exist. So I guess levels here, maybe we'll replace the word levels with permission access is probably a better one. So we do have different permission levels as far as what folks can see. And it mostly has to do with, there is a signatory level, which is somebody who actually can sign an initial agreement. And that would be a manager level that can speak on behalf of the agency, that actually signs up the agency with ODMAP. Then we have the administrator, who's just kind of the day-to-day manager of the ODMAP account from the agency perspective. And so they'll be the one that can grant users access to ODMAP. They'll be able to give them rights to see the national map, et cetera. So they just kind of manage the day-to-day, and they may or may not be the same person, the signatory and the administrator. Then we have kind of the general user. This is somebody who will most likely be granted access to the national map and just kind of be able to use the data that they're seeing on national map, and really just somebody who might also be entering data in the field. So those are kind of your general ones there. If you're an administrator, again, you're going to be able to grant access to users. You'll be able to kind of oversee the MOU process if somebody is requesting to share information with you specifically, and then you have that general user. So those are going to be those permission levels in general that you'll see.
Is there an agency type that you would recommend engaging with first when you're looking to bring on ODMAP into your community?
Yeah, so when we are recommending looking at agency engagement for communities that maybe have no agency involvement overall, we recommend reaching out to local law enforcement as well as local EMS. That will kind of give you your best coverage. And honestly, really will also depend on how your community is responding to overdoses. So depending on different states, you have EMS that are responding primarily first. Sometimes you have fire and rescue that are being called to scenes first, and sometimes you have law enforcement. Here in Virginia, we have some agencies where law enforcement are no longer actually responding to overdose calls unless there is extenuating circumstances. Therefore, it's going to be our EMS and fire that are going to be responding primarily, and so they would be the ones to submit the data to ODMAP. But I would recommend really looking on the local level, if you're a local level or county level, et cetera, to see who is going to be primarily responding to overdoses. My suggestion off of that is primarily look to see if your EMS right there would be willing to be the introductory agency in your community, because they are most likely responding to the majority of calls overall. If you're looking at those types of agents, or those three just different types of agencies that I just mentioned, I would reach out to your EMS first.
Makes sense. Absolutely. You mentioned in your presentation about certain states and regions having legislation passed that required inputting data. Do you have any more insight into those ongoing legislative efforts, if they are still ongoing, if there seems to be a groundswell of more states trying to pass that type of legislation? Do you have any insights into that?
Yeah, so we have, as far as statewide implementation, yes, we have several that have gone the legislative route. So for example, in Maryland, there's legislation that their state EMS agency is required to submit on non-fatal overdoses through an API with their state EMS agency to ODMAP. So that has been in place for a couple of years now, and I think that's just because it's local to us, and our deputy director worked with the state on making that happen, has been kind of our primary example. However, there are agencies, there are states across the country that have been able to pass this, including Florida. There's agencies in Illinois that have passed it, and then I believe Oklahoma, but it kind of just depends, Oklahoma or Wyoming. But it kind of just depends where they're at. We do have a document on ODMAP.org that we worked with LAPA on that helps outline some model legislation. So that way, if they can if they would like to go that route, states can kind of look and see what statutes might already be in place and can just kind of update or draft initial legislative language to help make that happen. We do have some movement in some other states. One we've been trying to work on a lot, or a couple we've been trying to work on are Pennsylvania and Virginia, but we're happy to work with any state agency that is perhaps interested in pushing that legislation through. But it does, we do have the EMS route, and we do have state efforts for reporting overdoses through the state police. It kind of just depends on which route they'd like to take.
So going back to the two different kind of routes that users can input the data, you mentioned that there's the direct route, basically the manual entry, and then there's also setting up APIs to work with the different systems that a lot of these agencies use. Do you have the information off the top of your head on kind of what the breakdown is with agencies using ODMAP, which ones are using the manual way and which ones are using the API, and if there's been kind of an overall consensus that one is easier to use or better than the other?
Yeah, so I will say hands down, manual entry is still the primary route. APIs take a little bit of time, obviously, to set up because potentially there is a third-party vendor. Perhaps you have a record management system or some other type of system in place that you need to bring in that third party, which we have done with several different national and local RMS agencies. So we're happy to work with them as well. But I will say, hands down, our manual entry is still the primary mode of our method of entry. For me, as far as ease, from a user perspective, I would definitely recommend looking into an API. It takes a little bit more time and coordination up front, but it's the way that we have it set up, where once it's set up, it's just kind of done unless there is some sort of change that's needed on like a case definition, etc. But once it's set up, the way that the coding works is it's called backwards compatible, which I'm not the tech person on our team. We have a lovely gentleman who is in charge of that, who can speak directly to the folks that can make that happen. But as far as my understanding with backwards compatible is that once it's done, even if we haven't updated our system, it doesn't require an additional update to the API unless there is a specific change from the other side. So it's something where we've had a lot more inquiries into APIs in the future, especially for agencies that are a little bit larger or state level agencies that are really trying to or have a larger number of overdoses versus smaller agencies that might have, 10 in a week versus like Chicago or Los Angeles that have where their spike is like 91 in a 24-hour period. So those are the types of agencies that we've been getting API onboarded first, but we're definitely getting a lot more interest in APIs. And if that's something, if you're an ODMAP user and interested in, I'm kind of the point of contact, happy to help coordinate, because it's one of those systems where for APIs, you get the right people in the right room and they go, oh, this is pretty straightforward. We can make this happen. And then you don't have to worry about it. And it also is important because it doesn't change the protocol for what data entry system is already in place. So if you have first responders already entering data, then it just pulls from that record management system. They don't have to change anything. They might add a checkbox that creates that trigger that pushes the information over. And for law enforcement, it's great because they just use their usual data entry. It's already set up to go. They understand that the back end understands what it needs to do. And then they don't have to, they don't have to open the website to enter the data. They can just go straight to their next call. So it kind of just depends what's best for the system. But I will say overall, my recommendation is the API because once it's set up, it's good to go.
Absolutely. Absolutely. Circling back to, the type of agencies that can have access to ODMAP, I have a question from the audience asking for you to clarify. Do you need to be an agency that inputs data in order to access ODMAP, or can you just more or less be an agency that can just read the data that's out there?
Yeah, so you can definitely be an agency that just basically is a user, a non-data contributing user. Our fastest growing type of agency has been the public health sector, whether it be behavioral health, Department of Health, et cetera, across the board, hands down. I want to say we're just seeing more and more public health agencies. Those are not going to be your traditional data contributing users, but they are the ones that are going to be part of that system on the ground for the response effort. But they will not be contributing data. So no, you do not have to be a data contributor to be part of ODMAP.
Awesome. Well, that is the last question on my list. I'll go ahead and put a call out there to the audience. We still have a couple more minutes. If anybody's got a final question or two, please send them our way and I'll make sure we can get some time so Allie can answer them. And while we're waiting on that, Allie, do you have anything else that you wanted to reiterate? Anything else that you'd like to bring up while we're waiting for any final questions?
Just again, thank you guys for letting me come and talk about ODMAP today and our system and how that real-time data can really contribute to helping to drive decisions on the local level, state level, and regional level. And then if you have any, if you're ever interested in looking at ODMAP or potentially joining ODMAP, just going to odmap.org. We'll give you kind of next steps and also provide some additional material if you're interested in doing that. But we're always interested in making sure that we can provide the most amount of data to as many people as possible. And so again, thank you guys for joining today, and happy to follow up with anybody if they have any additional questions or are interested in learning more about our system.
Awesome. Awesome. Well, thank you. And to that end, we'll go ahead and put some of that information up on the screen now. Again, here's the URL to the ODMAP program. Also have the URL to the Washington, Baltimore high intensity drug trafficking area, just if you'd like to get some more information on that organization and the organization that Allie comes from, as well as her email address, again, to contact her with any questions you may have about ODMAP and becoming an agency and that whole entire process. Does not look like we have any other questions, so we'll go ahead and start wrapping things up now. And again, just say thank you one more time to our presenter for taking the time out of their day to present the material for today's webinar. So Allie, thank you again for taking the time to provide the information in the presentation and this wonderful question and answer session. I think it's been a great, very well received piece of information. I'm hoping that a lot of people will start contacting you with how to sign up for ODMAP.
Great, and thank you guys for inviting me to come present today.
Before you leave today's webinar, we ask if you could participate in a short 5-minute survey. You will see a checkbox icon directly above the chat. Simply click that button to be linked to the audience feedback survey for today's event. Your feedback about our webinars is critical information that helps us improve and continue to provide you the best webinar experience possible. If you could please take those few moments to complete the survey, we would greatly appreciate it. Lastly, across the top of the live stream window are links to all our social media profiles, including Twitter, LinkedIn, and Facebook, a link to our website at forensiccoe.org, and a link to listen to episodes of the FTCOE's podcast, Just Science. There's also a link to sign up for the FTCOE newsletter so you can stay up to date with everything that FTCOE is doing in support of the forensic community. Thank you again for attending, and we hope everyone has a great day. All right, we are clear of the live stream. And yep, all set. Awesome. Sorry about the shaky start.
Oh, no, you're fine, because you made me actually sound like very smooth considering Friday I would have barely breathe. So thank you. No, not as scary sounding as I thought it would be in my head.
No problem at all. It was easy. These are way easier than I think a lot of people believe. I just appreciate you, being a good sport and hopping on and power through, not feeling 100% that day. So I appreciate it. And also just your patience as we scrambled to get things set up correctly on this side. But yeah,
I was afraid you were going to make me re-present like in person. It's been
No, fortunately, that wasn't the case. Everything was good on our side. It was the actual streaming service literally went down and was having issues with streaming at 12:20. And I did not see that. I'm supposed to get via email anytime that there is like a service issue with the service. And of course, for whatever reason, that didn't come into my inbox. So I didn't know until I went to start spinning things up. And that's why it was kind of a mad dash to figure something out. But we got YouTube in there and figured that out. So so we're good there. And I'll get the archival set up here. I'll probably have time to flip that over today and then get the final head count of the audience that attended. So just be on the lookout. I'll send you an email, kind of just follow and wrap things up for everything today. But again, I appreciate it, and hopefully we'll have you on in the future.
Awesome. Thank you again for inviting us. And thank you for all your help again, making it sound like I knew what I was doing.
No problem at all. Thanks, Allie. Appreciate it.
Have a good one.
You too. Bye.